Welcome back to the Deep Dive. Today, we're looking at something pretty interesting happening in healthcare down in Athens, Georgia. It's about the Gowdie Family Care Center, GFCC they're called, and a new, very personalized, patient-driven approach they've just launched. And our mission today, really, is to get beyond the buzzwords. We want to unpack what this new dimension of healthcare, as they put it, actually means on the ground. What are the specific changes, the investments that make this different for people in Athens? We've looked at the source materials, and that's what we're digging into.
Yeah, and it's important context, right? Primary care is, well, it's the cornerstone for most people's health journeys. And GFCC isn't some newcomer. They're known in Athens, respected, a top-tier family practice, actually, with over 10 years under their belt focusing on quality, patient-first care. So this isn't a startup trying something flashy. It's an established player making a really calculated shift. A pivot, you could say.
Okay, so before we get into the new stuff, let's just baseline it. What does GFCC already offer? What's the foundation this pivot is built on?
Right, so they offer a pretty comprehensive range of services already. Think standard, good family practice stuff, but with a clear focus on integration. That includes healthcare for adults, for kids, women's health services, naturally, plus preventive care, managing chronic diseases, and they do virtual visits too, which shows they're already blending that personal touch with, modern access. Leadership-wise, it's spearheaded by Dr. Erica Gowdie. She's described as very experienced, renowned family doctor. And the whole team, the staff, they really prioritize patient well-being and satisfaction. It's got that family-friendly vibe, apparently, built up over a decade.
Okay, so that established trust is key, which brings us to the main point. They claim they're taking patient-centric care to new heights. Big words. If they were already patient-centric, what specifically makes this new personalized patient-driven approach different? Where's the actual change? In time, money.
That's the million-dollar question, isn't it? And it hinges on the difference between patient-centric and patient-driven. Centric is, okay, I listen to your symptoms, I treat you well. Driven means we're partners, we set the health goals together. You, the patient, are more in the driver's seat for the long-term plan. So while they always aimed for bespoke care, this new push means, investing more resources, more time, probably different tech, into making that individualization really happen. The stated goal is unparalleled primary care in Athens. To do that, our sources suggest, implies things like maybe smaller patient panels for doctors, allowing for longer, more strategic appointments rather than just quick in and outs.
Right, that makes sense. Longer appointments, more strategy. But does this mean it's like a boutique service now? Is there an extra cost, a subscription maybe, or is this just how they operate now for everyone?
From what we can gather from their mission and community focus, it seems integrated. The idea is to enhance care quality within their existing setup. The CEO's quote focuses on fostering stronger doctor-patient relationships. It sounds like a strategic shift to improve outcomes by digging deeper into root causes, not just managing symptoms quickly. Less volume, more depth.
Okay, so it's about committing the time and resources to break out of that, typical 15-minute checkup cycle we see everywhere. I like the philosophy their spokesperson shared. Healthcare is not a one-size-fits-all deal. Makes sense. But how do the services actually change to reflect that, beyond just saying the patient drives?
Well, it translates into moving beyond just general guidelines. It's about deep individual risk profiling. So instead of just, okay, you're 50, here's the standard advice, it becomes, okay, based on your genetics, your lifestyle, your history, let's create a tailored plan and we'll adjust it as your needs change. That's how the service adapts dynamically to you, rather than slotting you into a predefined box. It's meant to be responsive, highly specific, and this commitment shows up immediately in 3 practical pillars, changes patients can expect to see right away.
Okay, practical pillars, let's hear them. What are the 3 big changes?
Right. First, there's a magnified focus on personalized preventive care, going way beyond the standard annual physical. It's about predicting issues before they even start. Second, a much bigger emphasis on supporting patients through lifestyle changes. The tough stuff, diet, exercise, stress management, real support. And third, a stronger push for early detection. More systematic vigilance to catch potential health risks much, much earlier.
Okay, the second one, lifestyle changes. That's huge. And notoriously difficult in medicine, right?
Yeah.
That takes more than just advice. It needs real engagement, maybe behavioral skills. So what about the doctors? Are they just told to do this now, or is there specific training to make this work?
Oh, absolutely. Specific training, that's crucial. It's what makes this more than just a policy memo. It's a structural change. The primary care docs at GFCC, who remember, are already well regarded in Athens. They've gone through specialized training specifically on how to apply this more advanced patient-driven behavioral change model. And that training is key because, let's face it, traditional med school is heavy on diagnosing and treating what's already wrong. Effective lifestyle support. That uses things like motivational interviewing, coaching techniques, helping people actually make and stick to changes. It's a different skill set.
Wow, so they're training doctors in behavioral science techniques. That really does change the whole feel of a primary care visit, doesn't it? So appointments might shift from just reporting symptoms to like proactive coaching and risk planning. That sounds like it needs more time, maybe different tools too. Big investment.
It absolutely is. And that early detection piece reinforces it. Focusing more on early detection suggests using more specialized screening, maybe advanced risk tools. They're not just looking for the usual suspects. They're building these individual risk profiles to catch subtle signs earlier than generic screenings might. That's where the specialized training pays off clinically.
Okay, so let's tie it all together. You've got specialized training, this focus on behavior change, more time invested, earlier detection. What's the bottom line for Athens residents? What's the intended payoff for the community?
Well, the center itself links it directly to community confidence. They explicitly say this move should boost Athens residents' confidence in their commitment to health. It seems to be about reinforcing that trust they've already built. Basically, by showing they'll fundamentally change how they work to get better, proactive results, they're hoping to tackle patient disengagement, getting more people actively involved in their own health, knowing they have a real partner in the practice.
So wrapping up this deep dive, it seems Gowdy Family Care Center's new approach isn't just talk. It looks like a serious structural commitment investing in individualized care mechanisms, requiring specialized doctor training in behavioral health, and pushing hard on proactive prevention. And it's happening now. They seem to have moved past just the idea and put the tools and training in place for real patient-driven care.
Exactly. And that leads to maybe a final thought for our listeners to chew on. If this model, with its deep dive into lifestyle support, behavioral coaching, early risk spotting, really takes hold, how might that change what we even think a primary care visit is over the next, say, 5 or 10 years? Could this standard checkup become less like a quick fix station and more like a strategic planning session for your long-term health? A true partnership.
That's a fascinating shift to imagine, a really fundamental change. For listeners who want to learn more about Gowdy Family Care Center, their services, or this new approach, we have the contact details right here from the source materials. You can call them at 706-410-2684. Their physical location is 1500 Oglethorpe Avenue, Athens, Georgia, 30606. Online, their main site is https.gowdyfamilycare.com. That's gowdyfamilycare-2. And for specifics on primary care, check out https.gowdyfamilycare.com, primary-care-2. They also have a Google business profile, easy to find at https.app.glkqqrz4 and PT73XR BobbyYJP6. Thanks for joining us for this deep dive into healthcare innovation and what it could mean for community wellness.